Good evening, everyone. My name is Serra, and I am Program Officer for UNITAID, working on this portfolio that is currently closing out. Just to mention that I worked on NAMSAL as well between 2016 and 2018. The NAMSAL trial, like Pam mentioned earlier, was one of the trials within UNITAID's ART portfolio that sought to generate evidence on second-generation antiretrovirals in low and middle-income countries. So what was the main objective of NAMSAL? It was a non-inferiority trial that compared dolutegravir to efavirenz at lower dose. And the scientific premise for this was results that came out from the ENCORE and the single trials. So the single trial showed that dolutegravir had a favorable profile in terms of sustained viral suppression compared to efavirenz 600. And then the ENCORE trial went further to show that efavirenz at lower dose, 400, was as effective as efavirenz 600. And so the NAMSAL trial compared dolutegravir to efavirenz 400. Adult participants were randomized into one of those treatment arms, and primary endpoint analysis was done at 48 weeks. These are the results which I will not dwell on because the papers are published, and I would plead that you just go back and check the details of the results. But summarily, non-inferiority was shown. Dolutegravir was shown to be as effective as efavirenz 400, and these results were confirmed at week 96. So viral suppression for both arms, so the proportion of participants that were virally suppressed at 48 weeks, where the proportions were similar in both arms. And what were the policy implications? So these results directly fed into WHO guidelines and also were adopted by countries. So the picture on the right, the extreme right, the green photo, those are the guidelines in Cameroon on antiretroviral therapy and care for people living with HIV. We have heard the previous speakers have spoken a lot about monitoring, and so this is an important implication. As we have rolled out dolutegravir, it is important that programs invest in monitoring for weight gain, for hypertension, and for all the other comorbidities, as well as viral load monitoring, of course. We thought that we should share the lessons that we learned from the NAMSAL trial. And this is probably the most important lesson we learned. And this was around misinformation. So the picture on the left, that is a photo of the NAMSAL launch. And that's the Minister of Health at the time in Cameroon. UNITAID was present. It was a happy moment for NAMSAL. Recruitment has started, and everything was going as planned. However, days later, there was a newspaper that published this article about 600 guinea pigs for a clinical trial. And of course, that was the NAMSAL trial, because it was the NAMSAL trial that was referenced in that report. How did we manage this? Like the other speakers have mentioned, involving the community and civil society organizations and all the other stakeholders was really instrumental in going past this phase. Just to mention that the Ebola trial came to Cameroon a couple of months before NAMSAL and never ever saw the light of day. And one of the reasons was misinformation. And so this was a huge risk to NAMSAL for discontinuation of the trial. However, the community was very instrumental, and civil society organizations, they were very instrumental in fighting this, because there was one civil society organization leader who was involved from protocol development and so understood clearly what the NAMSAL trial was and had the right messaging for members of the community. And then these stakeholders, especially the community members and civil society organizations, they were very helpful in facilitating transition of patients from the trial to the national program. The next lesson we learned was building tenacious and flexible teams. In the course of this trial, we had the WHO DGT signal, which suggested that infants born to women exposed to dolutegravir had neural tube defects. And so this was enough to create panic among the women, but there was action that was taken almost immediately to revise the protocol and to change follow-up for these women, switching some women, and also proposing contraception. The COVID pandemic also came. This is definitely not peculiar to this trial, but it needed that teams be flexible and work even on weekends and do more home visits for participants who consented to that. The next lesson we learned was the importance of collaborations. And Francois is going to speak a bit about the TRIO collaboration, which has been instrumental in producing new data, especially on weight gain. And so we just want to highlight the importance of collaborating with other studies and other trials with similar objectives. The last one is not really a lesson, but probably a benefit from this trial, which was around building local capacity, which we've been talking about, and is very important in generating context-specific evidence, which we definitely need if we have to attain our 2030 goals. Thank you.